Hello, my name is Alexandra Warner. I am doing a neurological assessment for Health Assessment Fall 2010. This is my patient, Eric Warner. I would like to ask his permission to do this video.
Yes.
I'm going to start with level of consciousness. Can you tell me your name?
Eric.
Can you tell me your date of birth?
1372.
Can you tell me where you're at right now?
Malvern, Arkansas.
Can you tell me what time it is?
12 o'clock.
Okay, now I'm going to do memory. Can you tell me what you had for breakfast this morning?
Bowl of cereal.
Can you tell me where you were born?
Anderson, Nevada.
Now I'm going to do smell. Olfactory cranial nerve 1. I'm going to ask you to smell this. You smell it?
Mm-hmm.
What does it smell?
Cinnamon.
You smell it on both sides?
Yes.
Now I'm going to do cranial nerve 2, the optic nerve. Tell me when you can see my fingers.
See him.
Tell me when you can see my
See
fingers.
him.
Tell me when you can see
See
them.
him.
I did confirmation. Now I'll do visual acuity. I would have him stand up and do the Snell chart, which we're not going to do, but if I was to test optic nerve 2, I would do visual acuity. Now I'm going to use my ophthalmoscope to look into his eyes, look at his optic disc. I would turn off the light. Eyes. Red reflex is present, and reactive. Now I'm going to do oculomotor, cranial nerve 3. I'm going to look at the size and shape of the pupils. I'm going to do their reaction to light. They're equal and reactive to light. I'm going to do convergence. So you look at my pencil, follow it with your eyes. Now I'm going to do accommodation. Follow my pencil. Now I'm looking for extraocular movements with the pencil. That's trochlear nerve number 4. You watch my finger. Now I'm going to do the trigeminal nerve. I'm going to palpate the temporal. Can you clench your teeth? And the masseter, clench your teeth. Now I'm going to do sensory. You see your hand? I'm going to do sensory here. Tell me if this is sharp or dull.
Dull.
Tell me if it's sharp or dull.
Sharp.
Tell me if it's sharp or dull.
Dull.
Now I'm going to do corneal reflexes. I would have a wisp of cotton. I would touch it to his cornea. Will you open your eyes, please? Now I'm going to do the facial nerves. Do you raise your eyebrows? Do you frown? Do you close both eyes? No. I'm going to try to open them while you keep them closed as tight as you can. Okay? Will you show me your upper teeth? Will you show me your lower teeth? Will you smile for me? Puff out both cheeks. Okay, thank you. Now I'm going to do the acoustic nerve. I'm going to whisper something to you. Repeat what I said. Baseball.
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 Okay. Now I'm going to do the Rhine test for air and bone conduction. I'm going to touch this. Can you tell me when you stop hearing it?
Stop.
You still hear it?
No.
You hear it now?
Yes.
Okay, now I'm going to test for lateralization with a Weber. Tell me which side you hear it on or both.
Neither. Both.
Okay, with bone conduction. Now I'm going to do the glossopharyngeal and the vagus. Can you say ah?
Ah.
Can you swallow? And then I would use something to do the gag test that I do not have to do, but would have him open his mouth, stick something in there, and gag.
Oh.
Now I'm going to inspect the tongue. You open your mouth and keep your tongue in. Now we move your tongue from side to side. Okay. Okay, now I'm going to do the spinal accessory muscle. I'm going to look at his back and make sure it's symmetrical. Can you push up on my shoulder, up on my hands? And I'm going to look at the front. Can you please push up on my hands? It's symmetrical. Now I'm going to do deep tendon reflexes. This will be my reflex hammer. This will be my pointing side, and this will be my flat side. First, I'm going to do reinforcement. Can you pull in your hands? Now switch. Okay. Okay, now I'm going to test his knee. Now I'm going to do the bicep. I'm going to have you rest your palm on your knee. I'm going to and I will do that on both sides. A little hyperreactive. Now I'm going to do the tricep. Now I'm going to do the brachioradialis. I would like to put your hands on your lap. Grab your They are 2+ and reactive. Now I'm going to do the knee. Relax your knee. 2+ and reactive. Now I will do the ankle. I will lift up his ankle. I will do it on the side of the ankle. And then I would test the Babinski. Clench your toes. Now I'm going to assess coordination. Will you put your hands on your lap? Can you move them back and forth as fast as possible? It's equal on both sides. Now I'm going to do point to point movement. Can you do this for me with both hands? And that's symmetrical and active, not weak. Now I have to stand up for me. You walk back and forth across the room. Gait's normal. Now I will have him walk foot in front of foot. Back this way. There's no shuffling. There's no odd movements. He does it properly. Now I'm going to test sensory pain. Can you tell me if this hurts?
Yes.
Is it sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay, now I'm going to do temperature. I have 2 cups here. One's got hot water and one's got cold. Can you tell me if this is hot or cold?
Hot.
Can you tell me if this is hot or cold?
Cold.
Is it same?
Hot. Cold.
Now I am going to test for vibration. I would have his foot. Put your foot down. I'm going to tap my reflex hammer. Can you feel that?
Yes.
Vibrating?
Vibrating.
I did that on both sides. Now I'm going to check for position. Can you see your foot? Other foot. Can you tell me, can you close your eyes? Can you tell me if I'm pulling your toe up or down?
Up. Down. Up. Down.
Okay. Now I'm going to do discrimination. Keep your eyes closed. You see your hand? Can you tell me the shape I'm drawing on your hand?
Heart.
No.
3.
Correct. Now I would place a coin in his hand and ask him to tell me what the object was. Can you tell me what that is?
Coin.
Now I'm going to do 2 points. Can you tell me where you feel this?
My wrist.
At 1 point or 2 points?
At 1 point. 2 points.
2 points. Now I'm going to do touch. Can you open your eyes and tell me where I touched that at? Correct. Now I'm going to do 2 points on the opposite sides. Can you close your hands, eyes? Can you tell me where you felt that at? Correct. That is the end of my assessment. I hope that you enjoyed this video. Thank you for taking the time to watch it.